The real motivation behind being a physician is to care for patients. But particularly in the field that I'm in, it's really to make strong connections with patients and their families. The decisions that we have to make often are difficult. The topics are difficult, and sometimes the outcome is a bad one. And you have to make very strong connections with patients very early on. You have to provide compassion to them and the best care possible. And that's really what gets me out of bed every day. I chose my specialty in hematology and medical oncology mainly out of an interest to learn more about cancer. When I was in high school, my maternal grandmother was diagnosed with pancreatic cancer, and it turns out that I didn't know very much about that disease or what caused it. As a result, I applied for and received a scholarship through the American Cancer Society and did research in a lab at Georgetown in Washington, D.C., and became interested in what drives cancer's growth and what makes it aggressive and why it's different and acts differently in different people. In college, I did more research in a lab in immunology to understand the immune response to cancer, and this led me to my fellowship training and my current specialty. What motivates me as a physician is obviously to care for patients. The particular field that I'm in has a lot of new information that comes out on a monthly basis, and it's fascinating to learn about these new drivers of cancer, new ways to treat cancer, and help patients get through their cancer journey in the best way possible. So my philosophy of care is really to treat the patient first. This seems like an obvious point, but we're not treating diseases, we're treating patients with diseases. I think there's also a very important emphasis on the time you can spend with patients. Time is a very limited resource, but I believe in providing as much time as possible for patients and their family to go over treatment plans, to understand how this disease might impact their life, and to try to help them through the process as smoothly and as easily as possible. When I first learned about Inspira, it became clear that the hospital system as a whole was focused on providing the best quality care for patients in the most compassionate way, in the most patient-centric fashion. So the new cancer center was designed with patient input in mind. It has a comfortable healing environment. Patient access is paramount. Multiple different disciplines can see patients in one area so that patients don't have to find their way through the building. And I think it's paramount to have strong relationship with your patients. Patients are aware that technology is out there, and they like to know that the latest technology is being used in their care, but they don't want it to get in the way of their interactions with their physicians. So it's important for us to make sure that we have close contact, that we pay attention to our patients, and that we focus on providing care.